Hey guys, Dr. Ben here, author of the book Blood Sugar Doesn't Lie. And today I want to go over something that a lot of people are hearing about that is very common in the research now that we're looking at, and that is what is called type 3 diabetes. And a lot of people will call type 3 diabetes Alzheimer's or Alzheimer's type 3 diabetes, but what does that really mean? What is going on, and how does elevated blood sugar cause neurological degeneration or damage to the brain? So let's get started with the basic physiology. So basically, when you eat food and it converts into glucose, so this could be from a carb, a starch, a grain, any type of fruit, anything like that. You eat that, it converts into a glucose in the bloodstream. And the body says, oh great, we love glucose. Glucose fuels the brain, it fuels our cells. A lot of different things are happening. And so what happens? Well, the body says, okay, let's grab a hold of that and put it into our cells. And in the cells, we can use it to make energy. So this is the great beauty of our body, and being able to use that glucose, be able to turn it into energy. But when we start having excess glucose, which a lot of people eating the standard American diet are doing, they're having excess glucose. Even for people that aren't eating a lot of sugar, that aren't eating a lot of bad foods, they're getting this glucose spike. So then the body, the pancreas specifically, kicks out a lot of insulin, grabs a hold of that glucose, and when we start doing this day in and day out, over and over and over, it's going to cause what we call insulin resistance. So insulin resistance is basically that key. Insulin is trying to open up the door, but it's that key hole that gets worn out, that doesn't respond like it's supposed to. And so then we get elevated glucose. Glucose is sitting out there trying to get into the cells, but it can't, because we have what's called insulin resistance. Those cells are not responding to insulin anymore, and we get elevated glucose. Elevated glucose, just like I talk about in my book and we talk to patients every day, is going to affect hormones. It's going to affect neurotransmitters, it's going to affect inflammation, all these different things that start contributing to neurological degeneration, specifically in the brain, specifically Alzheimer's. So everyone has heard of diabetic neuropathy, where your hands and fingers and toes and feet start losing nerve sensation. Some people get burning, some people can't feel it, a lot of different things happen. Well, guess what? Neurological degeneration, neuropathy of the brain, that is definitely not something that we want to have happen. So that is what we call Alzheimer's. Inflammation in the brain causing neurological degeneration. So what happens then? Well, over time, this is a degenerative condition. It gets worse and worse and worse. So if somebody has diabetes, they are going to get Alzheimer's if they live long enough. So get this for a stat. 33.9 million people in this country have prediabetes or insulin resistance. And this is one of the reasons that we test patients non-fasting. A lot of people like to test fasting, but they're really just looking for cholesterol and to see if you need to be on a cholesterol medication or statin. Way bigger issue than just that. So what we look at is, we look at insulin, we look at GGT, which is fatty liver. That tells us that blood sugar is going up and down, up and down, up and down. It tells us about your fasting glucose or non-fasting glucose. A lot of times people will even be crashing throughout that day, and then they're spiking up. And so we look at triglycerides and cholesterol and all these other markers. Yes, your blood sugar is going up, but for a lot of people it's crashing down as well. And that's going to contribute to fatty liver. That's going to be a bigger strain on the body. I have some patients come in 100-point swings throughout the day. Major stressor on the body, causes lots of inflammation in the body, especially into the brain, into that neurological system. So then we look at, what does that do to the rest of the body? It throws off hormones, it throws off inflammatory processes. Almost every single patient that comes in with joint pain, their knuckles hurt, their knees hurt, whatever, we start stabilizing that blood sugar, boom, their inflammation goes down. We don't have to do acupuncture and laser and massage and chiropractic and all these different things to get their joint pain to go away. The hormones, polycystic ovarian syndrome, PCOS, they give young women that are 120 pounds not overweight, they give them metformin, which is a diabetes drug, because there is such a connection between blood sugar and hormones. So as people get their hormones out of balance, a lot of times there's a blood sugar component that's contributing to that. So we've got to bring this back. We've got to balance it out. It's not just as simple as stop eating sugar. That is an oversimplification of the process. We've gone through well over 2,000 blood sugar monitors with patients, and I can tell you we have looked at thousands and thousands of days of diaries of food and checked their blood sugar with it. And guess what? There is no number one story. There's no number one answer. Some people, sweet potato is worse than white potato. Some people can eat a banana, other people can't. It's way more individualized than we ever knew. So what does that mean? Well, we've got to individualize it to that person. And as we do that, we figure out what someone truly needs to be eating. So the first place we start is to figure out where somebody is in that continuum. Are they in insulin resistance, pre-diabetes? Are they full-blown diabetes? Are they not even insulin resistance yet, but they are having these 100-point swings? We've got to figure out all those tools, and ultimately we're looking at preserving the brain. This is such a crucial part. You know, when you look at $10,000 a month spent on taking care of somebody that has Alzheimer's, you know, that's billions of dollars a year that we could save our healthcare system if we can preserve that brain tissue, if we can downregulate that inflammatory cascade to not destroy more tissue. It's not that complicated. It's something that we do with people every single day. I say to patients all the time, we can reverse your diabetes in as little as 6 to 8 weeks if you play the game. But what's the game? And that's what we've got to figure out together. So if you have any questions, if there's anybody that you know that's dealing with inflammation, hormone imbalances, they're losing memory, brain fog, any of these things, forward on this video. We love getting the information out there. We'd love to answer any questions. Go ahead and like or share. Go ahead and throw any questions into the comment section below. But if you've got any questions, we'd love to answer those, and reach out, and we'll get you guys feeling better. Make it a great day.